Hi, it's Dr. William. I wanted to show you a patient prior to having a tummy tuck and lipo, and why is she a really good candidate for having a tummy tuck with lipo. It's a tummy tuck and 360-degree lipo, or a tummy tuck and 10 areas of lipo, which is the same thing. So there's a few things I want to point out. This is a preoperative photo. Number one, she has a lot of excess skin. So you have to have excess skin in order to have a tummy tuck. So she has a lot of excess skin. You can't really even see her mons area very well, the pubic area very well, because that skin is overhanging. Number two is she has an older belly button, and that is going to be rejuvenated, made to look better. Now, I'm not going to be able to get all of these stretch marks when I do the tummy tuck, but when I do the tummy tuck, I'm going to take roughly this amount of skin here. So all of these stretch marks here are going to be relocated much lower. But one thing that's really nice about her is she has beautiful skin in this upper part of the abdomen. I mean, it really is very youthful skin. So when we remove the skin with all the stretch marks, that excess skin is kind of a doughy feeling to it. When we remove that, we're going to be replacing it with the skin in her upper abdomen that is really nice and soft and looks very smooth. Remember, when this skin comes down from above, the belly button just stays in the same spot. So the belly button is attached to you. So if you look here, and let's say this is your abdominal wall, here's your belly button. So the belly button stays there, but the skin comes down and it comes out through a new opening. And this skin here will be the area where the belly button is coming out, and it's really nice, good quality skin. She has a good waist, and so you can see her waist here. And you can see that her body is kind of coming in, and if I remove that fat, she's going to be much thinner, because when we do lipo 360, it starts up in the back, high in the back, goes all the way down through the key area towards the butt, and in the front, it's the same thing. We're going to get all of this fat in here, and this skin will all be removed, but also going to do some lipo here on the back, and that's going to bring all of that in. But you can see that she's got a nice waist. She's got a smaller waist. It's hard to appreciate here. You really can't tell in a photo whether somebody has diastasis or not. I know that she did. What is diastasis? Well, diastasis is a separation of the muscles. And you can't really tell by just looking at her, but if we just kind of drop a line down the middle here, what that means is that there's a separation here of the muscle. Let's say her muscles are here, and they used to be over here. So this is where her muscle is now. Just by tightening up the muscles and bringing them to the middle, that'll also make her waist a little bit smaller. She doesn't really have a lot of internal fat. This area here where you think, oh, she must have a lot of internal fat, most of this is external. And remember, there's a big difference between external fat and internal fat. The internal fat I can't touch. I can't get there because it's in organs, it's in and around your intestine, and it's something that you can't remove that. It's part of the structure of your body. To get rid of the internal fat through weight loss, but I can't get it through surgery. But here, it can give you the impression that she has quite a bit of internal fat, but I know that this is really mostly external, which is great because that will give her a big change after surgery. So kind of just reviewing her criteria, what makes her a good candidate is she has a good waist, she has low internal fat, she has excess skin, she has good quality skin in the upper abdomen, and she has some diastasis. All of those things combined are going to make her a good candidate. So let's look and see what happened after she had her tummy tuck and her lipo. You can see right away, I mean, the first thing I look at, where my eye goes, is always to look at the outside of her body, is to look at the Ogee line. And she has just a beautiful curve here. Now, this part of the curve, I really didn't do anything because she didn't have a BBL. She just had lipo and a tummy tuck. I didn't do anything to this area. That's just her leg coming up. She has a beautiful shape right here. And then at about this point, this would be the key area. And so that's where I did the lipo. And that's what will bring that line back in and keep that nice and smooth. And then the rest of this is all lipo here. So this comes up through the key area. That was all lipoed. And then this is all the lipo here, up high in the back, all the way down through the mid back, the low back, to get that really pretty shape here. So she's got a beautiful contour. And then if we go and we look at her abdomen and take a look at it, remember I was talking about the stretch marks and how she really didn't have too many. So really, if we look at where these stretch marks are, they're all low. Most of them are really, that I can see anyway here, are really all below her belly button. And then remember how she had this really pretty skin in this upper abdominal area. It's really, really nice. And they gave her a nice belly button, a nice shape and a nice look to her belly button. And the plication, where she had that wider diastasis, has been performed. So now she's much flatter. So she has a really pretty result. She was a very good candidate. The better the candidate you are, the better the result you will have. And so I always try and preach to patients to exercise, eat clean, get rid of as much internal fat, because we want to get results like this for everyone, and we want everyone to get in the best shape you can before surgery. The better you look before, the better you will look after.